So today I'm going to walk you through and talk to you about some of the technology that we use here in the clinic for both detecting subluxation, finding out where your problems are, as well as monitoring your progress over time. So today I'm demonstrating the 𝐬𝐻 software. And what we do with the scans, we do a thermography scan and then a surface EMG scan. The thermography scan is actually measuring, it's a high-tech, very sensitive thermometers that are measuring the temperature alongside the spinal cord. Here on the left you see a thermography scan results right here. This is in a bar graph format, which is important because it shows us where this patient's highest readings are, which are up here in the neck at this C1 area. She also has high readings in the C5, C6. We can also demonstrate this in a line format, which is important to us because we're not just interested in what the readings themselves are, but we're also interested in the pattern. We know that a healthy body is continuously changing. It's continuously working to maintain homeostasis, adapting to stress and all of the input that we're constantly bombarded with. So a healthy nerve system's constantly changing. We don't want to see somebody locked in the same pattern visit after visit. All right, so the next side of the scan, the next scan that we do is called a surface EMG. Very similar to probably what you're familiar with in an EKG, which measures the contractions of the heart and the heart muscles. Here, what we're measuring is the muscle tonicity and the muscle activity right alongside that spinal cord. This is important because muscles don't fire on their own. They only fire if a nerve tells them to. And we want those muscles to be firing symmetrically and balanced from left to right in order to keep your spine and your nerve system balanced. That's going to demonstrate a healthy spine and nerve system. We want this scan to look like this. We want all of these readings to be green and even on both sides. That's representative of a healthy nerve system. What we're looking at here is a nerve system that's under a lot of stress right now. We can look at it on the balance graph right here, and you're going to see that this patient's muscles are pulling predominantly to the left, so her body's going to be continuously listing to that left side. I'm going to take you through this scan and show you just in a little bit more detail how this can tie into the different organs and systems in the body. So if you have a subluxation up here in this top level of the neck, the cervical region, especially the C1, these nerves impact your pituitary gland, your brain, also your ears, the inner ear, outer ear, so both hearing, balance, equilibrium. This can show up in patients with symptoms such as headaches, nervousness, anxiety, insomnia, chronic recurring head colds, allergies, sinuses. Even in some cases, this will show up as high blood pressure, heart palpitations, symptoms of anxiety and depression, dizziness, and chronic fatigue can definitely impact our sleep patterns. As we work our way down the cervical spine here at C2, these nerves go to the eyes, sinuses, tongue, so it can impact your vision. Sinuses, again, we're talking allergies, sinuses. We as East Texans, we know that's a big issue around here. All right. In the children, earaches, or even adults, excessive wax production, and fainting spells. That's certainly not something to take lightly right there. We've seen that in a few different patients over the years. At the C4, C5 region, these nerves go to the glands of the neck, head, face, can impact things such as the tonsils, adenoids, cause laryngitis, hoarseness. C6, again, the nerves right there to the tonsils, but you may feel this, you may experience tightness, stiffness, soreness in the neck. In some cases, you may feel that radiate out into the shoulders, even eventually showing up as numbness and tingling in the hands and fingers. Oftentimes, carpal tunnel. Folks think that that's a wrist problem, but the reality is most often that can be linked back to a neck problem. Problems in this neck, especially the lower cervical neck. That's part of the group of nerves called the brachial plexus. The nerves here at C7, that goes to your thyroid. Us girls, we really understand the importance of thyroid, and if you've ever struggled with thyroid issues, you too can definitely appreciate that the thyroid's important for many things. It is one of the master hormone regulators in the body, so anytime we have hormonal issues, always need to consider thyroid and get that thyroid tested. However, we can get blood work done, we can test the thyroid, but yet still most folks don't realize it's also tied back to the spine and the nerve system. Many times someone with a thyroid issue has had years of chronic cervical pain, stiffness, tightness, and many of the other symptoms we already talked about, and they just never related that to the thyroid. If you have thyroid issues, it can impact your sleep patterns, body temperature. Maybe you're too cold, maybe you're too hot. Those are duties of your thyroid gland. Weight loss also. When we get into the upper thoracic region, right here at the upper thoracic at T2, guys, these nerves go to your heart. And again, you would feel this as tightness in the upper back, maybe even the neck, possibly radiating out to the shoulders. We all know one of the cardinal signs of a heart attack is pain coming down this arm and numbness and tingling in the hands and the fingers, all right? But it's not an arm problem, it's a spine problem. And this spine problem can definitely create heart problems. So with the heart, you're looking at things like high blood pressure, low blood pressure, heart palpitations. And many times these things aren't detected, they aren't found until it's too late. We know that 50% of the time, most folks don't realize they have heart disease or a problem with the heart until they experience the very first heart attack. And for 50% of those people, they die with the first heart attack. Guys, that's more than 300,000 Americans per year dying of heart disease that could have been detected and corrected. In the T3, these nerves go to the lungs, can cause issues such as bronchitis, congestion, frequent infection, like the bronchitis, influenza, asthma, those type of issues. All right, working our way down here, T4 is the gallbladder. I would say that's probably that and tonsils, two most common organs that I see removed from the human body. I like to think God knew what he was doing when he put these organs in there, and that gallbladder definitely serves a purpose. This T4 upper thoracic region, definitely a frequent area where we experience tightness, stiffness, pain, soreness through there. All right. T5 are the nerves to your liver. The liver is super important when it comes to detoxification of your body. If your body's not properly detoxing and cleansing, this could definitely be a liver issue linked back to this mid-thoracic spine. T6, these nerves go to your stomach. Acid reflux, indigestion, probably one of the most common ailments that I see patients come in with, that I'm glad to say we also see clear up rapidly in our patients. All right. The pancreas, spleen, you can see as we work our way down the spine. I'm going to pause here at T9. These nerves are super important because they go to your adrenal glands. Your adrenal glands are your stress glands, and they pump out things like adrenaline, noradrenaline, cortisol, the stress hormones. If we have chronic stress in this area, it can actually cause and lead to exhaustion of these adrenal glands. So then when we are actually under stress and we need that burst of adrenaline, the adrenal glands are tanked. They have nothing left to give. This is what leads into adrenal exhaustion, which can also cause problems with high blood pressure, exhaustion, sleep problems, things of that nature. T10, here are the nerves to the kidneys. Chronic fatigue, again, nephritis. T11, the ureters. T12 are the nerves to the small intestine, large intestine, right there at T12, L1. This can show up in our patients come in experiencing low back pain, sometimes even pain radiating down the legs or across to the front side of that leg with the femoral nerve. But it can show up in the body with problems such as constipation or diarrhea. Guys, ideally, every time you eat a meal, you should have a bowel movement. The body has detoxification, cleansing processes to clean that waste product out of our bodies. If we're not dumping and cleaning that consistently enough, then we're going to be storing it up, and that can definitely lead to long-term problems. We should be having 3 to 4 bowel movements daily. All right, not 2 to 3 a week, 3 to 4 daily, right there. The nerves at L2 go to the appendix. L3, these are the nerves to the bladder, also to the ovaries, uterus, and the prostate. We see problems such as urinary weakness, incontinence as that gets severe. In the ladies, this could show up as menstrual issues, be it an irregular cycle, endometriosis, polycystic ovarian disease, things of that nature. L3 are the nerves that also radiate down the legs, and they go to the knees. They go to your knees, ankles, and feet. So somebody with chronic weakness or recurring injuries of the knees, ankles, and feet, that can very well be linked back to a problem in this L3 region. L4, L5, these are the sciatic nerve. Most of you have heard of that sciatic nerve. It is indeed the largest nerve in the body, and it travels from this lower lumbar spine all the way down the legs through here. Okay, can even cause problems with circulation in the legs. It travels with the largest artery in the body, which is that femoral artery. So when we have an inflamed sciatic nerve, that can definitely impact that femoral artery, which through a cascade of events can even contribute back to conditions such as high blood pressure. So guys, our body, it's highly complicated. It's definitely far more complicated and detailed than this program's demonstrating here, but I wanted you to see some of the software that we use here at our clinic, like I said, to both help us in identifying where the primary problems with the nerve system are, but also in tracking your progress over time. So we're going to come back and we're going to rescan this patient, and we should be able to see a significant change in these scans over time. So thanks, and we'll see you next time.